Many seniors try to eat healthy, but still struggle with blood pressure, cholesterol, and heart issues. Scientists had been searching for something that can help seniors with blood pressure, cholesterol, and inflammation. Something effective, not too expensive, and easy to find. And now, research shows that one tiny seed might do just that. Chia seeds. And the results from real medical studies might surprise you. Today, I'll show you exactly what science found, in simple words, and how chia seeds may actually support your heart as you age. Chia seeds benefits for blood pressure. High blood pressure is one of the most serious heart risks for older adults. Chia seeds are now being studied to see if they can help. A 2025 study published in Journal of Clinical Therapeutics analyzed randomized controlled trials on chia seed supplementation. The review examined chia's effects on systolic and diastolic blood pressure, as well as weight, waist circumference, and BMI in adults. The researchers reported that growing evidence suggests chia seed consumption may help reduce blood pressure, although results are not always consistent across all trials. Still, the overall trend indicates potential benefits, especially for seniors with elevated systolic blood pressure. Chia seeds benefits for cholesterol levels. Heart health is heavily influenced by cholesterol levels. Chia seeds have been investigated for their ability to lower LDL, bad cholesterol, and improve HDL. A 2024 research published in International Journal of Food Reviews evaluated the cardiovascular benefits of Salvia hispanica, chia. The review showed some trials reported no statistically significant changes in LDL or HDL when data were pooled. However, studies on chia seed oil, especially in obese women, showed significant reductions in total cholesterol and LDL, and increases in HDL. The authors concluded that chia seeds may contribute to reducing cardiovascular risk, particularly in people who already have risk factors like dyslipidemia. Chia seeds benefits for inflammation. Inflammation is a critical factor in heart disease, especially in seniors. A major 2023 study published in Journal of Advances in Nutrition Review found significant reductions in C-reactive protein, CRP, significant reductions in TNF-alpha. These are key inflammatory markers linked to cardiovascular disease. The studies included in this analysis used ALA from multiple vegetable sources, including chia seeds, and showed better improvements when the interventions lasted 12 weeks or longer. Chia seeds for blood sugar management. High blood sugar and insulin spikes can increase heart strain, especially in seniors. A 2024 research published in Journal of Nutrition and Metabolism reported, chia's fiber forms a gel-like substance that slows starch digestion and reduces post-meal blood glucose levels. However, chia supplementation showed no significant change in fasting glucose, HbA1c, or insulin in overweight adults. But here's the important part. The same review found a significant reduction in systolic blood pressure, which indirectly lowers cardiac workload. Chia seeds support healthy weight. A 2023 research review in Journal of Food Science and Nutrition explains that chia seeds are rich in soluble fiber that absorbs 10 to 12 times its weight in water, promoting fullness, may help reduce calorie intake and improve satiety, are linked to lower inflammation, lower insulin resistance, and reduced belly fat. So while chia seeds are not a magic cure, the scientific research shows clear potential benefits for seniors, especially for blood pressure, inflammation, artery health, and overall heart protection. If you're a senior or caring for one, adding 1 to 2 tablespoons of chia seeds daily may be a simple step toward supporting long-term heart health. Disclaimer: this video is for educational purposes only and is not medical advice. Always consult your doctor or healthcare provider before making any changes to your diet or treatment plan. The information shared here is collected from top medical research sources, but due to video time limitations, not all data can be included. For full research references, please check the video description.